just how much you mean to me. There must be some other way to make you see. If it takes my heart and soul.
Thank you so much for joining us. So we're so pleased that Mary's joined us today and taken the place of Dr. Roden, who unfortunately couldn't make it. So this is the chance where we're going to be asking your questions to our esteemed panelists. So if you do have a question, please text the number on the screen, 07773 501 721. So, yes, yeah. So just a brief introduction for all of our speakers before we start. So Mary is a midwife from Ireland. We're so pleased to have her here. Dr. Dermot Kearney is a cardiologist, and he's a former president of the Catholic Medical Association. He's known for his life-saving work with the abortion pill reversal. Ira Winter, who spoke earlier on, through her work at Fiat Fertility Care, she helps couples to conceive naturally, and through her naturopathy skills and knowledge of restorative reproductive medicine, she previously worked for the NHS for 20 years. Dr. Grace Langford is a medical doctor. She was a founder and president of Cambridge Students for Life at medical school. She also sat at the Institute of Medical Ethics Student Council. Greg Nolan is an accredited psychotherapist who has been working in mental health services for nearly 2 decades. He recently joined Rachel's Vineyard as a counselor. His practice is informed by the Christian view of the person. So thank you so much, all of you, for joining us. So my first question is going to be for Mary. So we had someone ask, how would you give advice to a young person or any person working who's a sort of healthcare professional who wants to use their conscience right to not take part in anything to do with abortion?
This is interesting that I find myself here today because in 1997 I was on the Right to Life March, and at that time I was lecturer practitioner in midwifery and women's health in King's College, London. And I ended up going into teaching and nursing to sidestep a lot of the ethical dilemmas that were facing us on a daily basis. And you're asking me now, what do you do? And invoking your conscience. And I know that faced me in London. I was in a hospital that did late abortions up to term, 1 a week. I had never heard the term feticide. So when one day I asked to look after a lady, not realizing it was a feticide, and then I asked what that was, and I nearly got sick. And then I had said I had known the language and I could communicate with her. Then I said, I really don't know enough of the language. So in a way, was I cowardly? But I was actually so shocked that this was a procedure that you would go up to the 9th floor and have potassium chloride injected into the heart of a baby and then come down and deliver. And I remember the woman that was over from another country was very beautiful looking. And I had gone in and met her. And it plays on my mind that I maybe could have done something, but I was in such a state of shock myself. So what I would say to you is, it is more prevalent now. So you need to be prepared for the situations that you're going to find yourself in. You do need to arm yourself spiritually, but you need to be very, very brave. And there are people in this room, I know Dermot personally, I know of Isabel through all her media, the media, but you something in you has to be able to say, in conscience, I'm not going to be involved in this. And so you need to really imagine scenarios that could confront you. And many of us, I'm fortunate that I grew up in a pro-life family. We had the first March for Life in Tralee in County Kerry in 1978, and my sister and I were holding the banner. And I remember the shots were support the unwed mother, which wasn't PC now, but those of you who are on this journey, I would say to you, come prepared. Seek out help from those of us who've been in these situations, and know that in conscience, you are doing the right thing. I just want to tell you, it's very heartbreaking what has happened in Ireland. It's so heartbreaking because once you legalize abortion, it's the biggest factor in increasing the numbers. In my county, the numbers have gone up 430%. So all I want to say to you is, my mother was a wonderful pro-life mother and woman and a nurse. And the day after the legalization of that horrendous abortion bill in our Dáil Parliament, we were in the Royal Dublin Craft Fair. I was exhausted from all the lobbying, all the media, all the collection of signatures for conscience rights. And along came the leader of the Fianna Fáil party. And my mother was trying to call me to tell him he was there. But fortunately I wasn't, because I wouldn't have been so nice or diplomatic. But he came over and he was shaking people's hands. And my mother said, big smile, she said, "You will pay dearly in this life and in the next for what you did last night. You never learn." And he was totally, totally shocked. And then he composed himself. And I thought, she was the right person to be there. So we will answer, not only in this life, but certainly in the next. So be brave, be very brave, and pray. Usually I pray, especially to St. Michael the Archangel, in those difficult situations. And there are a lot of brave people in this room, so.
Okay, we've now got a question for Greg. Somebody says, "I've heard people say there's no such thing as post-abortion trauma. How should I respond to this?"
What I would say is that diagnostically there isn't. There's no such thing in diagnostic manuals as post-abortion trauma, but we don't need to use the term. There's no such diagnosis as post-rape trauma. That doesn't exist. It was proposed about 2 or 3 years ago, and the people who compile the DSM and the ICDs, they rejected it as a diagnostic category. It's by the by. Nobody would suggest that due to the fact that there's no such diagnosis as post-rape trauma, that rape can't be traumatic. It simply is. But what we should be confident in using is the term post-traumatic stress disorder from an abortion. So I've been working as a therapist for the past 10 years, and I've worked with every shade of PTSD imaginable, really. And I've concretely worked with people experiencing post-traumatic stress disorder directly as the result of an abortion. So when pro-abortionists say there's no such thing as post-abortion trauma, they're trying to get you onto their ground. I wouldn't work with that paradigm. I'd say, fine, I'm not interested in whether or not that's the case, but there is definitely such a thing as post-traumatic stress disorder, PTSD, stemming from abortion. Amongst plenty of other things, I've worked with people who've experienced depression, suicidality, suicide attempts, panic disorder, specific phobia. The list goes on, OCD. It's led to multiple recognized diagnoses in diagnostic manuals. So I'd step away from the argument, does post-abortion trauma exist? Because it's a red herring, and it's a rhetorical strategy that's used in order to get you on the back foot, essentially. So move it to PTSD, use the term post-traumatic stress disorder. rather than post-abortion trauma. I think that's what I'd say.
Thank you. The next question is for Dr. Dermot. So this person asks, why don't abortion providers mention abortion pill reversal? It makes me angry that people don't know about this.
Because they're pro-choice. But that's one choice that you're not allowed to have. I've no doubt, and I have some evidence for this, and actually the best evidence comes from one of the strongest voices against abortion pill reversal, a guy called Daniel Grossman, who in California, he's an abortionist and a strong advocate of abortion pills and very much opposed to abortion pill reversal. And he was asked that very question because he was one of the initial leading voices around 2015, 2016, 2 or 3 years after the abortion pill reversal service had started. And he coined the phrase, it's junk science, it doesn't work, it's not necessary. And he was asked by a journalist from Huffington Post. Now, Huffington Post, I don't think, is a pro-life media outlet. I could be wrong. But he was asked, so Professor Grossman, what is your objection to this so-called treatment? Is it the treatment itself? He said, no. It's not the treatment. It's the rhetoric. It's the rhetoric that women change their mind. We know that women don't change their mind. If they're going to have an abortion, they want to have an abortion, and they're not going to change their mind. And that was his response. So I think a lot of information comes to us from that. And that made me think, so there is a strong reticence in the abortion lobby to accept that women change their mind, especially in relation to chemical abortions. As most of you probably know, 90% of abortions in this country are chemically induced. And that involves a two-pill process to take the first pill called mifepristone, which basically separates the developing placenta from the lining of the womb and starves the baby of nutrients, and in most cases will kill the baby. And then they follow it up 1 or 2 days later with a second drug called misoprostol, which causes contraction and expulsion of the baby and the other products of conception, at least when it works according to plan. So the majority are performed in this way. There is a window of opportunity, however. That's the one saving grace you can say about chemical abortion as opposed to surgical abortions. In a surgical abortion, once that instrument goes in, there's no going back. But with chemical abortions, even if the mother has taken that first abortion pill, mifepristone, because of the way it works by blocking the natural hormone progesterone. And if we give progesterone quickly enough and in high enough doses, we can, in many cases, not always, but in many cases, more often than not, prevent the abortion from taking place and save the baby. And that's the rationale for the abortion pill reversal. So that, first of all, is an acceptance that the mother has changed her mind. Now, they will not accept that the women change their mind. At least that was the very first argument that they put out there. And the reason for that, going back to Dr. Grossman's statement, is that if they accept that women change their mind, then a very uncomfortable question must be asked. Why do women change their mind? Surely this is a good thing for them. But if so many of them, and I believe there are thousands of women. We know, for example, that more than 5,000 babies have been saved by abortion pill reversal over the last 12 years. And a lot of those... And for every one saved, there was another, or for every 2 or 3 saved, there was another 1 or 2 that didn't survive. So if there was 5,500 or almost 6,000 successes, there's going to be another 3,000 or 4,000 that weren't successful, but where the mother changed her mind and they had become aware of the treatment option. So that's 10,000 women that tried the treatment and it didn't work, and then there may be many thousands more that don't even know about it, because certainly in this country and elsewhere there is a concerted campaign to hide the information. Because if they accept that women change their mind, they have to ask, why do they change their mind? And in this country and in Ireland, and I'm sure it's the same elsewhere, they're not getting any counselling. They're given one option. If you present to a healthcare professional, the NHS, with an unwanted or a troublesome or a crisis pregnancy, you'll be shuffled down one avenue, that is towards abortion. They're not told about the other options. They're not told, well, is there any reason maybe we could help you in some way? We could direct you to a pregnancy crisis centre that might be able to provide you with the resources you need, the emotional help, the financial help, the practical help, the friendship that you might need to help you through this. They're not put in contact with those helpful people. So I think that's the reason that it answers, or it raises very uncomfortable questions. And if it was acknowledged, I have no doubt that many thousands of women in this country would not proceed with abortion if they knew there was another practical, feasible option for them. And that would have strong implications for a strong financial hit on the abortion industry.
Thank you very much, Dr. Dermot. Okay. We have a question for Dr. Grace Langford. Do you have any advice for pro-life people who work in healthcare?
Yeah, thank you. So I think the first thing I'd say is just to really encourage you. You know, you're not alone. It can feel like there are so many people. It can feel like the culture is very against us. But in my experience of, you know, working as a pro-life doctor, so many of my colleagues, they're not adamantly pro-choice. They just don't want to think about it. They want to keep their heads down. And if you're alongside them and just gently witnessing, it can actually make such a massive difference. So I'll give you an example of a friend of mine who, during her pro-life obs and gynae, she's a pro-life friend of mine who, during her obs and gynae rotation, she, you know, let it be known to her consultant supervisor that she wasn't going to have anything to do with abortion, and they were very respectful of that. I think, you know, we're really lucky as doctors. Our conscientious objection is actually protected by law, so you can have courage to say you're not going to be involved. And so she sent that email, and a month into her rotation, one of her other junior doctor friends came to her and said, I hear that you don't do abortions? And she was like, yeah. And this friend of hers was like, oh, I was asked to assist for the first time today, and I've never really thought about it, but I was really horrified and she was quite traumatized by her experience. And then my friend was able to kind of talk to her, get alongside her and say, you know, you really don't have to be involved. If you're morally uncomfortable, you really don't have to, and kind of helped her to draft this email to her own consultant supervisor. And so the two of them then, during the rotation, conscientiously objected, and giving staffing in the NHS, and that was all it took for there to be quite a lot of issues when the abortion list came, that there were two of them now that wouldn't assist, and it became a stress to the staffing and rota people, which I think is fantastic. So yeah, I just encourage you there. That yeah, just being gently pro-life and saying yes when someone comes to you can actually make a massive difference.
Thank you. Ira, this question's for you. What one thing do you think children should be taught that would make a difference with abortion rates?
Probably just generally how the body works, biology. I think that there is a lot of time spent on the prevention of things and very little time spent that people really recognize how beautifully and awesomely the body is made. And if especially girls are learning that, I teach adults usually, and I'm always surprised how at the lack of general knowledge and at the surprise when people learn the basic, you know, how the body works and how the cycle functions, and how beautiful some of these images are of things that they never hear about in any other context. And I think that is a positive, and I think it does a lot in turning hearts, because they're recognizing the beauty of the body, they're recognizing that there's a plan in how the body is designed, and they're grateful for it.
Thank you so much. Okay, this is for anybody on the panel. Why are most doctors supportive of abortion when they must know the truth about life in the womb?
Yeah, so I think in my experience, lots of them just don't want to think about it. And I think that draws on the example that I gave as well, is you can then become numb to it when you go along the line and get more involved with it. But yeah, I think for the vast majority of people, you know, that doctors like most society, they're muddled and in the middle, and they're not passionately for it, but they kind of go along to get along. And that's why I think being pro-life and standing up can make such a massive difference, because it just takes, I like to think that I can kind of gently be a prompt to their conscience, and just question them, even on the on kind of the just earing them back towards a pro-life position. You know, we can say things like, how is it that disabled children get the right to life later than everyone else, that they can be aborted right up until birth? How is that okay? And so many people do feel so uncomfortable with that. So yeah, that would be my answer.
Yeah.
If I may add something, it's not just for the medical professional, but also in the work that, for instance, with the Kraton Model we do, is every couple that we teach, we ask them with regards to their receptivity to unplanned pregnancy, or the receptivity to a pregnancy with an unfavorable outcome. And this is exactly this, it's prompting the conscious, and at the time when we ask that question, the person is not in crisis, which means they have time to think about it, and then a dialogue is possible. So.
Could I just add, it's, I think also Grace and Ira are correct, are absolutely correct. And harping back to what Mary said earlier, medical students and doctors, they don't know their legal rights. They don't know that they can say, no, I'm sorry, I don't do that, on conscious grounds or religious grounds. And it is our duty as more senior and experienced physicians and healthcare professionals to inform our junior colleagues of their rights. Because it's very important that if a lot of doctors and medical students did know that they can say sorry, I think a lot more would opt out from becoming embroiled in that type of industry.
And just to say, in our hospital recently, we didn't have abortions, but the strategy has been to roll it out to every hospital, and it was because of the obstetrician that just retired wasn't participating. But we have an anaesthetist who's not participating, and I know she's moved into another area, but I remember her very distinctly saying, it's a red line issue for me. She just straight out. So all you need is somebody who's saying, no, in conscience, I wouldn't feel right about that. And actually, I should say too, maybe go to your line manager, whoever, and say, well, just to let you know, I have a conscientious commitment to life, so in conscience I can't go along with that. So we know that's there in our legislation, so that even if it becomes an issue around transferring somebody to the care of somebody else, go beforehand to your line manager and say, so I'd rather not be allocated somebody, you know, and I don't want to be allocated because I don't want to be put in the position where I'm having to get involved. So there are some protections, even though the conscientious objection laws are being, you know, I suppose, undermined in some ways.
If I can just add too that I'm not speaking specifically about doctors, but people in general. A pro-abortion mindset didn't just drop out of the sky. There were precursors to this, and I think a major precursor to a pro-abortion mindset is, well, you might say in the field of psychology in a sense, but it's the biological reductionism, okay? So materialism or biological reductionism teaches us that a person is nothing more than the cells of their body. And it's a very commonly held belief these days. So I work with the soul, not the body. I'm a psychotherapist, I don't work in the field of biology or medicine, I work in the field of psychology. So I work with the soul. And as Ira was saying earlier, people are surprisingly unaware of what the soul is. We all have a spiritual soul. That's reality. That's the absolute truth. Sigmund Freud, over 100 years ago, was an absolute materialist. He said there's no such thing as the soul. There's no such thing as the immaterial faculties of the intellect and will aren't immaterial, they're material. Materialism is atheism, okay? So we've got an immaterial, spiritual, rational soul. That's the truth. And when we say we're pro-life, we're not pro-biological. Well, we are. We're not pro-biological life. We're pro-human life. And a human being is a body-soul composite. And I think that the soul is left out of left off the table in these discussions a lot of the time. But I think that materialism was a precursor that laid the foundation for silly statements such as a baby in the womb is just a clump of cells. It's just technically wrong. It's an absurd proposition. Yeah.
The next question is also for anyone on the panel who has a view. If you're Christian or pro-life, do you have to hide this in your work? Are you worried that people will find out?
Oh, yes, of course. I mean, you cannot separate your Christianity from the workplace. And in my own personal experience, I made it, well, it came about, I think, the year of faith, around 29 or 2010, when Pope Benedict declared the year of faith, that he wanted Christians everywhere to display unashamedly what their faith was. And in our particular diocese in Hexham in Newcastle, our bishop decided he was going to encourage every parishioner in all of the parishes in the diocese to wear a little cross, just to show the symbol of their faith. It wasn't imposing their faith on anybody else, but it was inviting that if somebody wanted to either acknowledge it or even engage in conversation, that this was an opportunity. So I initially, I wasn't sure what the reaction would be, but I started to wear that little cross at work, thinking that somebody might tell me to stop wearing it. But it has been very useful in that it lets people know that I'm a Christian, and it lets people know that I stand by Christian beliefs. And engaging in some of the junior doctors, I mentioned that we have a duty to inform them of their rights in relation to conscience rights. And I took the opportunity whenever I was given a lecture or a talk to some of the junior doctors on cardiology or some aspect of medicine, I would just spend 2 minutes at the end just saying that before we finish up, I've got one very important message I want to pass on to you, that it may not affect you this year, but at some stage in your careers it will affect you, that if you're asked to do something that goes against your conscience, whether it be religious belief or some other ethical or moral belief, and you feel very uncomfortable about it, you have the right to say no. So I just wanted to let people know. And then people began to realize that, yes, Dr. Kearney is a Christian, he's Catholic, he's in the Catholic Medical Association, and he stands up for conscience rights. And actually the most positive feedback I got were from Muslims, usually from young Muslim students and doctors who were very pleased to know that they did not have to do something that would go against their religious and moral beliefs.
Thank you very much. Okay, we'll end with this one. This is for anybody. Is it medically necessary to have an abortion?
Certainly not. I mean, we have been proof to that in Ireland. And now, sadly, our numbers are 10,000 abortions plus. We were put up as a model for having the lowest maternal mortality rate in the world. Now, that's beginning to change a little bit. I know things are complex. Pregnancy has become more complex. But it is very, very different. Our legislation said a termination of pregnancy is a medical procedure intended to end the life of the baby. No doctor who is trying to save a woman's life is going in there to actually take the life of the baby. If both can be saved, they will do that. But if one is not able to be saved in an emergency situation, that's very, very different than going in with the intention to end the life of the fetus. So what is their intention? So no, it's never necessary to target and kill an unborn baby to save a life. It may be the consequence of trying to save the woman who is in close to death, or their sepsis is raging, but no. And just our bishop said to me one time, and it's always said to me, just Dermot said, he said there is no being human, there's no obstacle between being human and being Christian, he said. So just a good thing to think about.
Could I just add?
Absolutely.
I'll just add very, very briefly that there are, we do recognize that complications can occur in pregnancy, and sometimes emergency situations do arise, but it's important to realize the vast majority of these arrive well into the third trimester, where the treatment is not abortion, it's emergency delivery. So the aim is always to try and save both the mother and the child. Sadly, there are some situations where the child may not survive, but you're doing so to save the mother's life. If the mother dies, the child is going to die. That's particularly in relation to, the only two that I can think of where that sad situation may develop earlier in pregnancy, before the stage of 24 weeks, are acute chorioamnionitis, which is a severe infection of the membranes, which usually kills the child anyway, but it may be necessary, in addition to the supportive and antibiotic treatment that the mother receives, the child may need to be delivered to save the mother's life, because if she dies, her baby is dying anyway. And the second would be possibly a very early stage cancer of the uterus or the cervix, where it cannot be delayed to perform a hysterectomy, and in doing so, obviously, the child is not going to survive. Now, that's very, very rare. Cancers are rare in pregnancy, and when they occur, they tend to be diagnosed much later in pregnancy, but they're the two theoretical situations I could think where, tragically, the baby may not survive, but the aim is always to try and save both lives, which is the opposite of what abortion is.
Well, thank you so much. You're also excellent. We decided we had to actually ask you one more question. So if you wouldn't mind staying on for one more. We'd love a quick answer from each one of you just to end on this, which is, what's your best argument for being opposed to abortion?
The joy of seeing all the children and the faces of those parents who hold their child, that especially those who've really longed for it a long time and maybe had a long journey to get to parenthood.
The recognition that human life, without any scientific doubt whatsoever, human life begins at the time of fertilization, and there are no human lives less worthy of life than others. So all of us have equal inherent value.
I think for me, I've been pro-life since I understood what abortion was, because I just thought, if ending the life of a tiny human being isn't wrong, then I have no idea what is. So yeah, it's that simple.
I think it's an entirely logical position. Truth has its own resonance. St. Augustine says the truth always has a future. So I think it's completely logical. And while it's really challenging to care for somebody profoundly disabled or really accompany somebody, it's really sacred. And I've thankfully had the privilege, and I lost sleepless nights over a girl one time who wanted to come to England at 23 weeks. And I didn't know what happened to her. And then some years later, she was my student, but I never said anything, she never said anything. And then another time, another girl was 19 weeks, and I was 19 weeks with my daughter Jana at the same time, who's here today. And they wanted to go to England, and I didn't know what happened until one day my son came home and said, "Oh, there was a baptism." And I said the name was very unusual, and I said, "That's the baby that I talked to that couple about," and that baby became the joy of everybody's life. And that couple stayed together, and they were both in college at the time. So the rewards are so beautiful. It may be hard, but life is worth it. Life is worth it.
I think for me, just echoing what's been said, really, the humanity of the baby in the womb, it sort of depends who I'm talking to. If it's an atheist, I'll just talk about human rights, the right to life of all human beings, as defined by every human rights act in the world, really. But if I'm talking to a religious person, and I know what you mean about Muslims are much more on our side in a sense, and lots of Christians and Catholics even. But if I'm talking to a religious person, I'll bring God into the question. I'll say, God made this baby, they have a soul. If we, this humanity, the eternal destiny of the baby in the womb, that isn't considered again. So for religious people, bringing God into it, bringing the soul into it, bringing heaven, hell into it, the reality of creation.
That was so excellent. Thank you so much, all of you, for joining us. Dermot, Mary, Ira, Grace, and Greg. Everyone, please give them a round of applause.